Hello and welcome everyone. Once again, it is a great pleasure to welcome another Damsonian, another topper in the DAMS studio today. I am referring to Dr. Ankur Sharma here, who is very much with me in the DAMS studio, who has secured a rank 13 in the Army Dental Corps 2016. Congratulations to you, Dr. Ankur. Wonderful result, wonderful performance. How are you feeling?
First of all, thanks a lot. I'm feeling amazing. I mean, that could be the best achievement I have ever achieved. Uh, uh,
Well, I would say you should feel on top of the world.
exactly, you're right. I have prepared for MDS. My focus was not on Army Dental Corps, but one thing for sure: if you prepare for MDS, rest another things like junior residentship or these Army Dental Corps exam will follow your way. There is no other specific preparation for that.
Well, that's very nice to know. Dr. Ankur, before we grill you with our questions here, just tell a little brief about yourself.
Well, I did graduation from a private college named PDM Dental College, which is in Bahadurgarh. A lot of people don't know about that college, so it was a quite long journey for me. I prepared for about 2.5 years, and here I get the result. It was a long wait though.
So you were associated with the DAMS also?
Yeah.
Which course did you join?
I was in the regular batch of the DAMS, and it helped me a lot also.
Yes, let me just add on here for my viewers that we are referring to the MDS Quest course provided by DAMS. DAMS is the only institute to provide a comprehensive and a very useful course to the MDS aspirants by the name MDS Quest. Not just that, we also provide comprehensive and elaborate study material to the students in the course. Well, that is a small information given by me here, and I carry on with my conversation. Dr. Ankur, just tell us that how did you prepare for your exam and how did you manage your time?
Well, I started my preparation in my internship. I joined the DAMS during that time, and I was continuously associated with the DAMS from that time. I joined the regular course, covered all the subjects during my internship type, so that I can revise it on the exam on the 2-3 months before the exam. There are no specific study material for your study. You have to cover every subject thoroughly according to present day scenario. There is no particular question bank for any exam, I guess. So you'll have to follow the books, notes from the DAMS, and Dental Pulse, of course, that is the Bible for us. So you'll have to stick to all the basic things. Question banks nowadays are not useful at all in any exam.
Just because the pattern has changed, right?
Pattern has changed tremendously. I mean,
well, that is very useful information. I'm sorry to cut you, but that is very useful information that you are sharing with us. And one important questions that would come to you now is that how was DAMS useful in your preparation?
Well, I wasn't at all focused in the focus for doing MDS for being a private college student. Only few of them decide to go work and prepare for government MDS seat, which is very few nowadays. So it was DAMS who gave me some motivation. Especially, firstly, I met Dr. Gaurav and Dr. Kapil. They motivated me, and then I joined their course, and it was quite helpful for me. I mean, I wasn't focused about doing MDS. I was just reading, and I didn't have any kind of main aim, you can say. I wasn't doing reading the things properly. So getting a proper guidance about what to read, how much to read, and planning everything properly, that was a very important contribution from DAMS for me.
Thank you very much for your kind words. Dr. Ankur, that as we all know, that DAMS is very active on the Facebook medium. We have a MDS Quest Club and also the DAMS Dental Cloud. Can I have your inputs on these two?
Yeah, that I was going to mention. It was extremely good, I would say. That is the difference from other institutes and the DAMS. DAMS clarify each and every doubts of yours, and especially the Facebook clubs. There are 3 clubs: DAMS, MDS Quest 14, 15, and 16. I was in all 3 of them. So all the faculty, every one of them has reference from the books. If you post any doubt, it will be answered in less than 2 days. and sometimes it got answered even in less than 4 hours. So that's amazing. I mean, getting answer from the teacher who is giving you the reference from the book along with page number, that is the best thing a student can have to clear doubts. Everybody read, but the doubts make the difference. If you have the doubts clear, then you can get the rank.
Well, that's very nicely answered. I hope all our aspirants are listening to that. This is going to be valuable information that is coming out from the mouth of a topper here. I am talking to Dr. Ankur Sharma, rank 13 in Army Dental Corps 2016. As you have already mentioned that the trend of questions have drastically changed, and let me also share something here with our viewers. The DAMS is the only institute that conducts a CBT which is conducted in the actual format as the original exam, and also we have introduced a DVT, which is a DAMS visual treat, a session on image based questions which is only done by DAMS in the country to help the MDS students. This was introduced this year in 2016. Well, for some reason our topper could not take part in both of these for some unfortunate reason, but anyway, it does not matter to your performance. You have secured a rank 13 in the Army Dental Corps. That is wonderful. Now, can I have your comments on the study material that we provide to our MDS aspirants?
Well, according to the latest exam, which was on AIMS November 2016 and AIPG, that is NEET 2016, the basic book has again emerged out to be the Dental Pulse. That is the Bible. I will again repeat it. If you do it properly, nobody can stop you from getting a rank. Doing it some people say I've done Pulse 3 times, 4 times. That is not the way to do it. You have to do every question and the explanation along with synopsis along with it. The question doesn't matter. Their question doesn't get repeated most frequently, but the topics get repeated. So you'll have to read it. Almost I have read it about 7 to 8 times. Still I'm not sure if I know the Dental Pulse very well. Along with that, there are some questions, some topics which get repeatedly. DAMS give you the study notes and their class notes that cover approximately everything you need to be prepared for any exam. So these are two basic things. Other are some question banks about AIMS and AIPG. You have to do that before going to any exam. But basically Dental Pulse, I will say you'll have to do it thoroughly again and again. When you are sure you have done it completely, then do it once again. You'll find something new. I am damn sure about it.
That's very nice of you to mention all these things for our listeners here. We all know that DAMS is into dental paper discussions also for AIMS and AIPG. What is your take on that?
Well, the good thing about DAMS is whenever an exam happens, some of the faculty goes to the exam and gave it, and the question recalled are exactly in the similar manner which were asked during the exam, and the answers were from the reference books, not from some newcomers. So that you can trust it properly. Well, the answer makes a difference. If you have read a question and some question gets repeated and some other books have given wrong answers, that can take your rank from 200 to 2000. So even 2 question matters a lot. So proper answer of the question is very necessary. So that is the good thing about DAMS or their Facebook clubs, and you can ask personal doubts from by contacting the faculty directly also. Clearing your doubts should be done as soon as possible, because that makes a lot of difference for me. It made a lot of difference for me previously, and you should do that.
Well, that's very nicely answered here. I think clearing your doubts in a short span of time is, I find, is the most underlining words that you have spoken. Very nice. Thank you very much. Let us talk, more elaborately about the DAMS evaluation system. Now, with that, I refer to the online test and the subject-wise test, grand test, mock test that is available to the MDS aspirants. Can I have your opinion on this?
The great thing about DAMS is everybody have dental faculty, but the medical faculty of DAMS is a class above every academy in the India. So according to newest pattern of the NEET, about 30 to 40% of the question from the medical subjects, and for clearing those subjects you need to study medical, and that is the only thing that is going to make a difference in your rank. And the faculty of DAMS dental is common for medical, DAMS medical also, so that is a class above every other faculty, I must say, in the country. So their study material, their way of teaching the medical subjects, which is normally poor, which we cannot do. Being a dental student, I know about it, and everybody must be facing that problem during sudden notice, when we got the notice about the NEET exam ki bhai, it is going to happen in 3 months. Everybody was focused about the medical subjects. How will we do it? We were preparing for dental. Last year the paper was dental focused. How will we do it in 3 months? For the students from the DAMS, it was not a matter of being hectic or panic. So they just revised their notes, and I consulted many, including myself. I got a lot of help from those notes. Approximately 60 to 70% of the paper from the medical was from the notes. So it was not quite a big deal. And he helped in the army also interview. They asked about some medical questions. It was quite helpful.
Well, very much so. And let me tell my viewers here that I'm talking to Dr. Ankur Sharma, rank 13 in the Army Dental Corps 2016. Tell me, Dr. Ankur, which faculty in DAMS MDS Quest has influenced you the most?
Naming any one of them would be very short. There are many faculty. First of all, the person who inspired me was Kapil Singhal, Dr. Kapil Singhal, periodontist. He was also from a private college, and then he secured first rank in Jaipur, state first rank in Rajasthan. So I was quite focused. I was quite inspired about the person. He did his college, his bachelor's degree in private dental college, and just after his internship, he cleared the exam and got rank 1. So that was quite motivation for me. Other faculties, Dr. Ankit is extremely good. Dr. Gaurav Verma, oral surgery. Some of the other books are following his answers now, which were previously answered wrong in many books, including Dental Pulse. So in medical faculty, Dr. Arvind, he is a tremendous teacher in medicine. I mean, you cannot learn medicine in a better way than him. Other faculty, there are many names. It will take quite a long time. So everybody is good in names. The medical faculty is amazing.
Thank you very much for your kind words. And before we wind up this conversation, any message to your juniors?
Well, the first and the most important line is not to lose hope. There are very few seats, and the competition is amazingly high. So the only thing you need to stick on to the what you have started, and do not leave it until you finish it. So just keep working hard. Success will get back to you when you least expect it. So just work hard and let everything happen by its own. The motto is not to quit. Do not try to quit. If you worked for 1.5 years, 2 years, do not quit. Might be the next month in the exam you're going to get a seat, or going to get a good thing like Army Dental Corps, or any other thing like any other exams. Do not leave preparation in between unless until you get something good, because that will be a failure if you quit it in between. Your preparation, you'll get to know automatically you are preparing good when you start getting some good ranks. And you should double your pace of study at that time, because at that time you're very close to what you wanted to achieve. But whenever you try to leave it, or you are tired or you are disheartened by some result or not getting in, just think why you started all this. So that will be quite helpful in keeping your hopes high and preparing.
Would you recommend DAMS MDS Quest to them?
Definitely. That is one of the major reason I have achieved what I am right now. So definitely you should DAMS, the difference, there are many institutes, I'll be very honest. The different institute, everybody say we are better in this, we are better. The only thing is the faculty that matters the most in every institute. Uh, Doing question banks was a pastime journey. Some institutes focus on question bank, giving repeat questions in every test. Believe me, I have tried everything, but my friends were in other institutes, and I used to think sometime might be they are good, they are, but ultimately the question came according to the new pattern, and which doesn't belong to any question bank. So you have to read everything and anything about basically dental pulse about 8 to 10 times, and doing the pulse is not about doing the question. I'm repeating it again. Just focus on the explanations and the synopsis. Question doesn't make any difference in any exam nowadays, so that is the best thing you can do. And the other thing also, do revise the class notes. If you have read it once, do not quit it by just reading it once. Do it twice, thrice, as many times as you could do. First cover the subject from the pulse, revise it from your DAMES notes, and then proceed on to the next subject. And before proceeding, give the test of the particular subject. There are many subject wise tests in DAMES, that's also very helpful, and cover almost each and every topic of the subject along with explanation. So that's very effective in reading or doing preparation.
Well, thank you very much. Those were valuable, useful information and inputs by the topper himself. I'm talking to Demsonian Dr. Ankur Sharma, rank 13 in Army Dental Corps 2016. It's always a pleasure talking to the toppers and achievers. We wish you all the best. Thank you very much.
Thank you.